The information you will listen to in this video has been prepared by making use of the package insert of the drug. If the video is useful for you, don't forget to like the video and subscribe to the channel. Ativan, a drug from the group of anxiolytics, can be used alone or in combination with other drugs. The active ingredient of Ativan is lorazepam. What is Ativan and what is it used for? Ativan is a prescription medicine used to treat the symptoms of anxiety disorders. Ativan is indicated for the management of anxiety disorders or for the short-term relief of the symptoms of anxiety or anxiety associated with depressive symptoms. Anxiety or tension associated with the stress of everyday life usually does not require treatment with an anxiolytic. How is Ativan used? Read the medication guide provided by your pharmacist before you start taking lorazepam and each time you get a refill. Take this medication by mouth with or without food as directed by your doctor. The dosage is based on your medical condition, age, and response to treatment. The usual range is 2 to 6 mg a day given in divided doses, the largest dose being taken before bedtime, but the daily dosage may vary from 1 to 10 mg a day. For anxiety, most patients require an initial dose of 2 to 3 mg a day given 2 times a day or 3 times a day. For insomnia due to anxiety or transient situational stress, a single daily dose of 2 to 4 mg may be given, usually at bedtime. For elderly or debilitated patients, an initial dosage of 1 to 2 mg a day in divided doses is recommended, to be adjusted as needed and tolerated. The dosage of Ativan should be increased gradually when needed to help avoid adverse effects. When higher dosage is indicated, the evening dose should be increased before the daytime doses. Do not suddenly stop using this drug without consulting your doctor. Some conditions may become worse when this drug is abruptly stopped. Your dose may need to be gradually decreased. Here are some things to know before using Ativan. Before taking lorazepam, tell your doctor or pharmacist if you are allergic to it, or to other benzodiazepines, or if you have any other allergies. This drug may make you dizzy or drowsy or blur your vision. Do not drive, use machinery, or do anything that needs alertness or clear vision until you can do it safely. Before having surgery, tell your doctor or dentist about all the products you use. This drug may have the opposite of its usual calming effect in children, causing restlessness, shaking, or mental mood changes. Tell your doctor if you are pregnant or plan to become pregnant. You should not become pregnant while using lorazepam. If you become pregnant, talk to your doctor right away about the risks and benefits of this medication. Lorazepam may harm an unborn baby. This drug passes into breast milk. Consult your doctor before breastfeeding. Possible side effects with the use of Ativan include drowsiness, dizziness, loss of coordination, headache, nausea, blurred vision, change in sexual interest ability, constipation, heartburn, or change in appetite may occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If this video was useful for you, for support, like the video and subscribe to the channel. Share your views and experiences in the comments section. I wish you healthy days.